Hello everyone, today we are going to talk about something very important, and that is nutrition in pregnancy. I am Dr. Neha Gupta and I bring you greetings from Feminine. So what is nutrition? The food that you eat and the way that food affects your body is called nutrition. So by what I have given the definition just now, it becomes absolutely clear that nutrition is vital in pregnancy. Whatever you eat not only affects your body, it affects the development of the growing baby inside as well. So if the mother is having any nutritional deficiency, if she has deficiency in iron, if she is herself anemic, then the developing baby may also be growth restricted, meaning thereby the baby may not attain its full growth potential. If there are other nutritional deficiencies, like if she is hypothyroid, which means her thyroid is functioning slow, or if she has a deficiency of folic acid, if she has a deficiency of the vitamin B complex, then all these things can have an effect not only on the physical development of the child, but on the way the brain develops and the way the brain functions as well. So what are the dietary recommendations for a pregnant lady? There are some basal dietary requirements, that is for a non-pregnant lady who is doing a sedentary kind of a job. The basal calorie requirement is about 1800 kilocalorie per day. Now during pregnancy, this requirement is increased by an additional 350 kilocalorie per day, and in breastfeeding the calorie requirement increases further to an additional 500 kilocalories per day. Now when we talk about proteins, the requirement during pregnancy is roughly about 1 gram of protein per kg body weight per day. So if there's a lady who weighs around 60 kg, she would require around 60 grams of protein per day. During lactation, again the protein requirements are higher, so they're about 1.5 grams of protein per kg body weight per day. So it is very important to meet these calorie and these dietary requirements during pregnancy. Apart from the proteins and the calories, one should also take the required amounts of healthy fats, that is the saturated fats should not be more than 10% of the total dietary intake, and it is important to take a balanced diet. A balanced diet is the one which contains around 50 to 60% of carbohydrates, around 15 to 20% of proteins, and 10 to 20% of fats. So it's very important to take a balanced diet so that all the required amounts of micronutrients and minerals and calories and proteins of fat are being taken by the pregnant lady. Also, I'd like to tell that most of this, the calorie requirement, it goes up in the second half of pregnancy. In the first half of pregnancy, the requirements are not that much. So if somebody in the first 3 months of pregnancy, because of the various food aversions or because of the nausea and the vomiting, is not able to eat too much, then please do not worry. The calorie requirements are not increased in the first 3 months of pregnancy. Do not force yourself to eat. Just ensure that you are eating something, take small and frequent meals so that there are some calories going inside you. Gradually, as the pregnancy advances beyond the 3rd and the 4th month, the nausea and the vomiting reduce for most women, and that is when the appetite also improves, and that is when you can build up on your calorie and protein intake gradually. And what about the fluids? So one should remember to drink at least 10 glasses of water in a day during pregnancy. The total fluid intake should be around 2 liters in a day. Not just water, but from various other sources, like you are having milk, you are having tea, you are having coffee, you are taking some juice, you are taking buttermilk or chach, you are taking nariyal pani. So all that put together, you should be taking at least 2 liters of liquids in a day and at least 8 to 10 glasses of water in a day. This is very, very important. In pregnancy, the various hormone changes that happen, what they do is they slow the movement of the gut. As a result of this, pregnant women tend to have a lot of constipation. Secondly, pregnant women also have an increased tendency to develop urinary infections. So to counter both these problems of urinary infection and constipation, having a good liquid intake is very important. High fiber diet along with good amount of liquid will relieve constipation to a large extent. Similarly, drinking around 2-2.5 liters of liquid in a day will greatly reduce your chances of getting any sort of urinary infection. Now, what are the ideal foods that should be eaten during pregnancy? So I'd like to tell you here that there is no need to modify your diet that you take in routine because you're now pregnant. So one can actually just carry on with the usual diet, and but of course the calorie requirements and the protein requirements do go up during pregnancy, and that should be taken care of. It is very important to take a balanced diet, as I have told earlier, which means that the diet should be inclusive diet. It should have all the components, like it should have adequate amount of carbohydrates, it should have fats, it should have proteins, it should have minerals and vitamins in it. So taking at least 2 servings of fruit in a day, taking lots of seasonal vegetables, taking 2 glasses of milk in a day, taking some form of protein every day in the form of dal, in the form of paneer, soya beans, soya nuggets, egg white, and if you are a non-vegetarian, then eating chicken. So some form of protein should be there in the diet every day. The diet should be inclusive, as I have already mentioned. Other than that, a few important things that you should remember are that in pregnancy it is good to avoid any sort of spicy food. It is good to avoid food which has been ordered from outside. Also, one should not take packaged food or processed or canned products. Then the preparation of food is also equally important. Always wash your hands properly before preparing food, and the food, whatever fruits and vegetables that are being used, they should be thoroughly washed in running water. Especially with the non-vegetarian food, take care that the food is properly cooked. Eating uncooked or partially cooked, eggs or meat or chicken, they can lead to some infections. So that is not a good idea at all. Milk should be boiled before you consume. And if you have a pet at home, then also be careful that before coming in contact with the food, you're always washing your hands if you've played with the pet before touching the food. So those were some of the precautions which are very important to follow. Another thing is that it is good to take small and frequent meals in pregnancy. The pregnancy changes that happen, they slow down the gut, they increase the acid reflux. Because of these, the acidity, the burps, they increase. There's a feeling of fullness, there can be constipation. So it is good to eat in small portions, but eat every 1.5 hours or every 2 hours, like that. Drink lots of liquid, as we've also discussed before, and take a high fiber diet. Now, what are prenatal vitamins and minerals? So a lot of prenatal vitamins are available in the market. They basically contain the required amounts of vitamins which are good for the pregnant lady herself and her developing baby. So one of the most important vitamin is vitamin B9, that is the folic acid. Folic acid is needed for the proper development of baby's brain and spine. Now this development of the baby's brain and spine happens very early on in the pregnancy, before the pregnant lady even knows that she is pregnant. And as we know, more than half of all pregnancies are actually unplanned pregnancies. That is why it is said that if you're trying for a conception, then it is good to start taking folic acid or the prenatal vitamin immediately when you start trying for a baby, so that any time you conceive, the amount of folic acid required is already going inside and the baby has a good development of the brain and spine. The folic acid needs to be continued in the first 3 months of pregnancy, and it has to be started at least 1 month before you actually fall pregnant. Other than folic acid, there will be other vitamins in the prenatal supplements. There will be vitamin D, there is some amount of vitamin A, there is some amount of iron in it, there is some amount of vitamin B12. So all these vitamins, they are very good and they are important for the pregnant lady. They are safe to consume in pregnancy, and obviously they do not replace, or they are no substitute to eating a healthy and a balanced diet, but taking these supplements will make up for any gaps that may be there in your diet, and will lead to a healthy pregnancy outcome.